Dignity Health Cancer Institute is always working toward ways of fighting cancer. And today, we're learning the difference between melanoma and soft tissue sarcoma. And with me is Dr. Gonzalez-Velez. Did I say it right, doctor?
Yes.
Close to it. And then, of course, Dr. Wiseman, how are you?
Great, how are you?
Good. There's a difference between moles. Let's talk about that, because that should be concerning when you have a mole, right?
Correct. So moles are initially a point of concern for melanoma and other skin cancers, but the important part is when they change. Basically, when they are getting bigger, when they change color, or when they have any new things like itching or bleeding, that's when you really should get concerned. Otherwise, moles can happen, and as long as they are stable, you shouldn't worry too much.
Okay, so what causes these?
So mostly melanoma is clearly associated with sun exposure, particularly here in Arizona when we have sun most of the year. We have to be very careful and be very aware. It can also be associated with total sun exposure, sunburn, and also the use of tanning beds in some cases.
Wow. Okay, so what's some ways we can prevent this?
So the best way to prevent is avoiding sun with sun protecting factor, and also with mechanical protection such as clothing that protects against the sun, and avoiding the sun in a particular times, usually between 10 a.m. to 4 p.m. when it's more intense.
Yeah, it's kind of interesting that some of us make fun of people out there who have on the long shirt and have the hat on and the sunscreen, but that's what we need to be doing actually out there, especially with this hot sun going on. So it's amazing.
Exactly.
Dr. Wiseman, okay, let's talk about, of course, someone who has been diagnosed with melanoma or sarcoma. What are some of the treatments that you guys are doing?
Well, thanks, Brad, for having us. So when you're diagnosed with that, the first thing you want to do is find a team that's capable and very familiar with taking care of these types of cancers. For melanoma, you're going to want to see a surgeon and you're going to want to see a medical oncologist as well, and start to think of what treatments are available for these types of cancers. For melanoma, the mainstay of treatment is surgery to remove it, but depending on how advanced it may be, you may need additional therapies as well. Sarcoma, as Dr. Gonzalez-Velez pointed out, can take different shapes and forms, and so surgery is a mainstay treatment for that as well, but also systemic therapies, sometimes even chemotherapy.
Let's talk about the surgery, because is it where they're going in and just taking parts of the skin, or are they getting underneath and getting the melanoma out, or do you still have to go through certain chemo and treatments for it?
Yeah, great question. So for melanoma, one part of the surgery is removing the melanoma itself. You basically remove the melanoma and take some normal tissue around it to make sure you have it out completely. Depending on how thick it is or how aggressive it can be, sometimes additional surgery to just removing it, such as sampling the lymph nodes or removing the lymph nodes that are in that particular region. And we'll do studies to determine that preoperatively of which ones to sample. But certainly it can go from something simple to just removing the melanoma to removing the melanoma plus additional surgery.
So how should someone start to recognize they have melanoma or the soft tissue? Is there anything they should be looking for on their skin?
So as Dr. Gonzalez-Velez pointed out, one of the things to do is really just get familiar with how things look on your body. If things are changing, that can be alarming and you can bring it up to somebody. So following with the dermatologist or following with us at the Dignity Health Cancer Institute, something just doesn't seem right, the easiest thing to do is have it get checked out.
Yeah, you know, what's really cool is that there was, I forget the hockey team, but the coach, or the equipment coach, was on the bench, and the people behind him, she was a nurse, and she noticed he had melanoma on his back of his neck, and he didn't know that because he can't see back there, and she saved his life because it was more than what he was expecting. And so that's something important. It's kind of maybe even taking a look at your family members and recognizing what's going on with their body.
Absolutely, and that's a great point, because a lot of the melanomas or cancers that we see are in areas that people are trying to do the right thing, but they just don't end up seeing it. It's on their back, it's on the back part of their legs, and sometimes it's others that may find this first.
Yeah. Doctors, I'm so glad you guys came in. What I like is having you in here because it makes me feel more comfortable knowing that there's someone I can come talk to about this, and that's where we want the public to. It's very important to have this kind of team there. And you guys have an amazing team at Dignity Health Cancer Institute, so it's great. Thank you for coming in.
Thanks so much.
And of course, you can go to aztv.com to find out more information on Dignity Health Cancer Institute and all the other things they're doing there to, of course, fight cancer. So Thank you, doctors. All right, come on back. We got more Mixed right after this.